into the lecture portion. Thanks for turning on the recording. The Lean Healthcare Conference is happening at Stanford September 10th through 12th, so coming up in just over 2 weeks. Registration is open and early bird pricing is still available through tomorrow. So if you want to hop on that early bird pricing, please do so today or tomorrow. And our next lecture series is taking place on September 9th. Dr. Nazleen Baumal is going to be speaking about 2 studies of health-related social needs screening. So that'll be super interesting. And I hope you'll join us then too. And I'm also super excited about today's lecture. So we have Dr. Stacy Farr and Dr. Danielle Olds here today. They'll be speaking on transforming healthcare through the TIARA program, implementation practice to accelerate evidence adoption. And a little bio before we move on. So Dr. Stacy Farr is co-director of the Healthcare Institute for Innovations in Quality and associate professor at the University of Missouri, Kansas City School of Medicine and director of outcomes research at St. Luke's Hospital. She's a trained health services researcher in health policy. And Dr. Danielle Olds is the director of training and education for the Healthcare Institute for Innovations in Quality. She's a research associate professor at the University of Missouri, Kansas City, and a manager of outcomes research as well. So they both have some great roles, and I'm actually personally super excited to hear about this because I took the TIARA course this past year, and it was super, super interesting, and I learned a lot. So I'm super curious to hear about where it all started and what they have to share with us today. So just a little bit more before we get started. So we welcome questions. We will have about 20 minutes at the end of the lecture to go through questions together, but feel free to put your questions in the chat throughout, and Dr. Olds and Dr. Farr may, pick them up in the middle of their lecture. They may hold them for the end, and I'll also be coming off mute at the end for this Q&A session to kind of facilitate that. So if you have any questions, please, we welcome them, and we're excited to hear your thoughts. So without any further ado, Dr. Olds, Dr. Farr, please take it away.
Great, thank you so much. Let's just get our slides. Okay, and you all can see those? Great, I wonder if I should shrink these. The human faces, oh, not that way. It's this the little one. All right. Okay, so thank you so much for having us. We're really excited to be here and share just a little bit about the TIARA program, which is called Transforming Healthcare Through, sorry, never mind. Our title is called Transforming Healthcare Through the TIARA Program, Implementation Practice to Accelerate Evidence Adoption. And I'm Stacy Farr, and this is Danielle Olds. Let's get this accelerated, speaking of acceleration. So what we're going to do is we're first going to just give you a brief background about the Healthcare Institute for Innovations in Quality and TIARA. And then we're going to walk through and give you a high-level overview of what TIARA covers in terms of content. And then we obviously will save some time for Q&A and discussion. So you already kind of heard about us in the bios, so we don't necessarily need to reread these, but there's our bios for you. So a little bit about the Healthcare Institute for Innovations in Quality. First of all, the vision is really for the Institute, and this is an institute that exists at the University of Missouri, Kansas City. This is an institute with a vision of Kansas City delivering the highest value, most equitable healthcare in the nation, and which is obviously lofty, right? And then the mission is really to catalyze and facilitate multi-stakeholder collaborations to improve the quality and value of healthcare in Kansas City. And so really, in a nutshell, we're trying to create a learning healthcare community where we have a number of community partners, competitive hospitals, there's roughly 20 in our metro, and then payers, community-based organizations, researchers, et cetera, who all work together on these activities. And these activities, there's really 3 main pillars of our institute. The first of our pillars is really doing regional quality improvement projects. And you all aren't from our region, but this is a map of Kansas City. And 2 of our regional quality improvement projects that we've undertaken, and just showing you a handful, you can kind of see the list of competitive hospitals who participate in those. We also do, within one of these health systems, the St. Luke's Health System, we are also a part of the PCORI HSI, the Health System Implementation Initiative. And so after kind of understanding those regional quality improvement projects, in order to do that work, to actually implement evidence at different hospitals and measure the outcomes, we recognize the need to really build a customized training program. And this is kind of what we're going to talk about today, which is TIARA, which is training and implementation actionable research approaches. And then the third leg of our stool is really dissemination and engagement. And the primary mode in which we do that is through our IQ forums, which are bi-monthly forums we have to talk about different healthcare topics and hear from different healthcare stakeholders on their perspectives. So showing this to you in a little bit of a different way, our initiatives are primarily focused on educating and professional development, and that obviously includes TIARA. We've also done coursework, graduate level coursework in the past. And then we have the improvement of healthcare in Kansas City through our regional QI projects, as well as community engagement through our IQ forums. So now to dig into the TIARA program. So a few things, I guess, kind of backing it up. We all know that there are barriers to improvement. You're the audience who all know that and do this as well. We know that traditional implementation science, often feels very ivory tower or inaccessible for clinicians, can feel very academic, overwhelming, and requires expertise and time to understand and apply it. And we also know that, traditional QI can often lack some of the rigor we want in terms of applications of implementation science, and not really sometimes thinking and accounting for the context or the how of implementation. And TIARA is a program then that helps support the research to practice delay, where we can view it as the bridge to faster, more effective healthcare improvement programs. And what it is and does is provides organizations with frameworks to rapidly implement improvement and integrates QI and implementation science for actionable research. Also allows innovations that can be implemented faster, more efficiently, and with measurable success. So in the TIARA program, and there's a lot here on this slide, but there are a number of customized tools that we've put together and created that walk through the various activities within any implementation quality improvement project. And the primary leading framework, the process framework, is the QIPI, the Quality Improvement Project Implementation A3 framework. A little bit more about TIARA. We also offer TIARA in a few different mechanisms. One is annual offerings, where we offer this virtually, synchronously from January to like April or May, the spring semester. This is a 7-module course. We do every other week a live virtual learning lab, so that this then spans over 14 weeks. And then the cohorts progress. They, take 2 weeks for each module, have the learning lab, and then graduate at the end with their certificates. And then we also offer an asynchronous virtual, completely self-paced, where learners can progress at their own pace. There's no learning lab with that option. And then we've also offered customized, tailored programs for organizations. For example, we're doing this, within our own system for PCORI HSI. We also have just gotten back from Australia, where we did TIARA Down Under, as I like to say. I had to weave it in. Okay, so a little bit of the impact of the program so far. Here's one of our cohorts, our most recent cohort at our graduation and certificate ceremony. We've trained 3 cohorts in this model so far. There have been 80 plus TIARA scholars, not yet including our most recent one, of researchers and practitioners. There's been really high, rates of satisfaction and really people saying that this program is exactly what they were looking for in terms of wanting to learn the fundamentals of implementation science, but in a way that could be practically applied in the real world in QI. So a little bit of the influence and kind of far reach so far. You can see you all are in there as well. But you can see this is a map of the US. We have the red are the faculty members that participate in TIARA and their associated institutions, as well as the yellow are the scholars. And then the green is where we've done or are exploring some customized trainings. And as I had indicated earlier, we just got back from Australia, where we were offering this at the University of Adelaide and University of South Australia, as well as 2 hospitals there in a customized workshop. Oops. So the TIARA modules, there are, as we had said, there are 7 modules, but today we're just going to cover 6. The 7th one is a little bit about the future and recap and future directions. But first, we're going to walk through the first module is really the principles of IS and QI. 2 is the problem, current situation, and targets. 3, evidence-based practice interventions, 4, recommendations and strategies, 5, action plan and iterative improvement, and 6, sustainability applications considerations. So a little bit more TIARA learning objectives. The TIARA learners who do take the full program, are really learning how to get knowledge on effectively defining a problem, describing root causes, and developing implementation strategies for evidence-based interventions, appropriately defining targets, systematically measuring healthcare process and outcome improvements, and successfully implementing evidence-based interventions into practice. So to dig into, this will be a very whirlwind overview of some of the content that's covered in TIARA. So we're just going to kind of walk you through these. So within module 1, this is where we're first going to cover the principles of implementation science and QI. And I'm sure, this group knows much of this, but, when we first want to think about defining quality improvement, what is it? We kind of lean to this, the Batalden and Davidoff article of, the combined and unceasing efforts of everyone to make the changes that will lead to better patient outcomes, as well as the DHHS definition of the systematic and continuous actions that lead to measurable improvement in healthcare services and the health status of targeted patient groups. And then we think about countering that with implementation science and practice, where we think of implementation science as really the study of the methods versus implementation practice being the application of those methods of integrating evidence into practice. So here, fairly, big, busy slide. The concentric circles are always great. This is a great article from Mitchell Chambers. But this is thinking about health services research, where implementation science fit and quality improvement. And then we think about really what we're trying to do is implementation practice. And so it's really an intersection here of how we integrate, the science with the QI. So then also within implementation science, there are a number of frameworks. There are process frameworks, determinants frameworks, and evaluation frameworks that are all used. And the first to kind of think through and go through, which is really the first step, is the process models. So there are a number of process models and frameworks, obviously, that are used in implementation science QI. These are helpful to guide and support the planning for implementation. And besides the, which I should have included here on this slide, but besides the TIARA QIPI A3, there are a number of these process models, including the EPIS model, the VA Query Roadmap, the Institute for Healthcare Improvement, or IHI model for improvement, as well as logic models. And there's an implementation science one as well, IRLM. So next we go into problems. Okay,
Yep. So when we get into module 1 of TIARA, using our QIPI A3 framework, we start in this upper left-hand box of problem. And so we really go through what is the problem, why is it important, stakeholders, consequences, and then some aspects of the problem that help the project. So thinking about what is the problem, we talk about having a problem that's measurable, feasible in scope, and does not specify a solution. I think the not specifying a solution is often a pitfall of groups, especially those with more of a QI orientation. A lot of times they have an intervention in mind that's sort of in search of a problem. And then thinking about why is the problem important so that you can get stakeholder buy-in. So thinking about things like prevalence, mortality, morbidity, cost. We also in the program have a heavy emphasis on thinking through team members and stakeholders, with stakeholders being individuals or groups who are responsible for or affected by health and healthcare related decisions. We talk through stakeholder analysis. We use RACI, which is responsible, accountable, consulted, and informed. And we think through who should be included on this, including clinical staff who will be actually doing the work, patients. And then when we think about patients, thinking about what capacity we would engage them and which patients. So are these patients who've been affected by the problem, or maybe patients from an existing hospital advisory board? And then not forgetting administration, including leaders in the C-suite, compliance, QI, IT, et cetera. Next, we move on to module 2, which is current situation. And current situation is really thinking through the context of what's happening. So thinking through what's currently occurring, to whom, when, where, why, and how, current processes and workflows, and the performance gap. So when we think about context, quality or improvement results are often mixed and difficult to replicate. What works in one setting may not work in another, even if they're the same type of setting. And so we need to really think about context, because that's really crucial to project success. The importance of the context varies depending on the type of intervention being implemented, stage of development, stage of implementation, the system level targeted, and specific components of the intervention. In the TIARA program, we go through a lot of detail on different types of context assessment, including observation, interviews, surveys, document analyses like policies and procedures. We also talk a lot about process maps because they visually represent a workflow. They can be used to outline individual steps within the process. And they're really useful in communicating the processes and also revealing areas for improvement and helping to really understand the workflow and how the intervention might fit within a workflow. They usually start high level and then get more detailed as necessary. And we use this as an example from one of our regional QI projects that we use in the TIARA program. Current situation can also be assessed using QI tools, and so we really try to connect these implementation science concepts with QI tools that a lot of individuals might be familiar with. These include fishbone diagram, Pareto chart, 5 Whys, HFMEA, and many others.
And then also in module 2 is when we start to look at kind of the next box in the QIPI here, where we talk about targets and goals. And this is really where we're defining, the actual high-level goal to overcome the problem that we've identified, and then thinking through critically, the definitions for that outcome measure, and including obviously the operational definitions, so we can ensure we're measuring progress toward that goal, and then using SMART criteria. So at just high level, when you're thinking through the target that you would want to be moving toward with the problem you've identified, we're thinking about the operational definition, and that's obviously necessary for measurement. Those include your team thinking through the numerator statement, the denominator statement, as well as inclusion and exclusion criteria that you will be looking at. And then what's also really important was when you're defining the target or the goal for what you are trying to overcome is making sure you're applying the SMART criteria and really, I guess critically thinking that you're applying it and using it in how you define your goal, which is, specific, measurable, attainable, relevant, and time-bound. And then that takes us to module 3.
Module 3, which is evidence-based interventions. And so in this module, we talk through how participants can identify evidence-based solutions, and then we assess appropriateness by completing a tool that we created called the EBP-IAA. So the focus of implementation science in QI is putting interventions into practice, whereas clinical research is often focused on developing interventions. And so we really want interventions that already have an evidence base. And so at this stage, participants' goal is to identify at least one evidence-based practice, ideally more than one at this point. That way, later on, when they look at determinants, then they're able to select the best evidence-based practice, or if appropriate, they can create a bundle. And so in the TIARA program, we talk about ways to identify evidence-based practices, including systematic literature reviews, package interventions, and practice guidelines. So the EBP-IAA is a tool that we've used, especially in our HSII work. And it helps us think through Our health systems expertise in clinical champion. So do we have expertise in one or more dedicated clinical champions? And then for the potential intervention, do we have existing relationships with the necessary stakeholders to ensure project success? Is this a frequent or severe problem at our institution? And then is there organizational capacity and system interest in the project focus? And so we can think about this on based on value versus effort. So something that's high effort but low value is something you want to avoid. Something that's low effort but also low value might involve some further investigation. Something that's high effort but also high value is something we might want to consider for the future. And then something that's low effort but high value has the potential to proceed.
Okay. And then on to the determinants is the next section. So in the determinants, this is really where we review determinants frameworks and select the most appropriate one. And these are the ones borrowed from implementation science world. And then also to think about and select the appropriate QI tool to determine and understand what the root causes to the problem are. And then we developed another tool called the DART worksheet, where it helps with mapping the root causes and to the determinants framework. Excuse me. So again, kind of back to that slide of what are these implementation frameworks that we have, the process, determinant, and evaluation. This is where we can incorporate and think about the determinants frameworks and how they fit into the change you're implementing. So determinants frameworks, determinants are really factors that impact implementation outcomes. And it's important to note that these can be negative, which are known as barriers, or something that inhibits or restrains implementation or improvement, or they can be positive, or as facilitators that support or facilitate the implementation or improvement. There are also a number of determinants frameworks. A few of them here on this slide include the CFIR, Consolidated Framework for Implementation Research, also the PARIS, Promoting Action on Research Implementation in Health Services. There's also the Theoretical Domains Framework, or TDF, as well as the TICD, or Tailored Implementation in Chronic Diseases. And this is one that we save at the end here because we often use this in a lot of our work, and we use it just in a few of the slides you'll see moving forward. So what are some tools to uncover determinants? You can really learn and assess your determinants from a number of different things. This can come from the context assessment that was done during current situation. It also can be done, in a number of ways. So the process map can uncover some of these, as well as interviews, kind of thinking through, the determinants frameworks and applying those into interviews through observation and through baseline data analyses. And we go into that in a lot greater depth in the TIARA program. You can also uncover determinants from the QI tools that were also mentioned earlier and in greater depth in the TIARA program. So now this is called the DART. This is one of the tools of the TIARA program that we've developed, and this is called the Determinants and Root Causes Table. And what you can see here on the far left are the determinants, or the domains and constructs. And so, as I had mentioned, we were using the TICD as an example here. And so this is where we list kind of what the domains or constructs are from the determinants framework that was selected. And then as you move across the DART, then when you identify what those root causes and determinants are, that's where you can match those to the right domains and constructs from the determinants framework you select. And then from there, in the future sections, you can move into both strategies and the intervention. All right, so after determinants, so now we've uncovered all the barriers, facilitators, we know the problem, we're like almost there, right? Now we're getting ready to almost implement. So this is where we move to the right-hand side of the QIPI into recommendations. And here is where we really determine the intervention to implement and tailor it as necessary to the barriers and root causes that we identified. This is where we also identify strategies that'll be used to implement the intervention and the evidence base for the recommended intervention or strategies. And then also linking from the slide we just shown, linking those determinants and root causes to the strategies and intervention. So what are implementation strategies? This is really labeling the black box. Strategies are really defining the how of delivering and carrying out evidence-based interventions. Excuse me. So if we have the clinical intervention, and then we obviously have the outcomes that we want to achieve through that, we think of the strategies as really the how of delivering and carrying out that EBP. So implementation strategies, there's also this article that is called The Refined Compilation of Implementation Strategies from Powell et al. And this shows you, this is just, for a little bit of context, because we love context, right? This is a list of 73 different discrete implementation strategies. Here's just on the right is just, A through D in the alphabetical order of them, but a snapshot of them. So you can see that this is what we mean when we're saying what some of these implementation strategies are. So this is a busy slide, but this takes us back to the DART. And this is a DART that's been populated with already walking through identification of the guideline, on the far left, the determinants, the second column being those root causes and the actual determinants that were uncovered that mapped the determinants framework. And then now in this section is when we are really labeling specific strategies and customizing those to our own context and putting those into the DART. And then in this case, it was the problem that we were applying this project to was a re-implementation. So that's why it says re-intervention here. But it was relaunching a program that had a number of failures throughout. And so we had taken through this TIARA framework to address the problem and improve and do a re-implementation. And so then you can see you move into a bundled re-intervention here, which we go into much greater detail in the actual TIARA program. I'm just trying to look at the clock here. We're doing all right? Yeah. Okay, and then I'm only gonna pause before we get on to module 5 and say one more thing. If there is anything urgent in the chat, just feel free to shout it out to us and interrupt us because we're not able to actively monitor it in the viewer. But now we'll keep going.
All right, so module 5 is moving into the action plan and thinking about iterative improvement. So now that you've done the identification of the problem and the current situation or context, you've identified some evidence-based practices, you've identified the facilitators and barriers, and then selected the evidence-based practice that you'll implement, and then strategies to implement it that are aligned with the determinants. Now you're ready to actually do the implementation. So here we are on our QIPI A3, and you'll see there's a lot going on in action plan. So there's sort of this top section where you identify implementation outcomes and measures, and then it gets into more of a traditional PDSA cycle that's more traditional QI. So one of the reasons why we have implementation outcomes before the PDSA cycle is that you need implementation outcomes to assess the intervention and the strategies and basically to assess how your implementation is going. So you have strategies, and then we map them to implementation outcomes, and we come up with measure definitions. And these are different from the global targets of the project. And so a global target may be a clinical measure, for example, and an implementation outcome might be fidelity, for example. And as I mentioned, implementation outcomes help you understand the implementation itself. So once we have the DART completed, we move into this other tool that we created called the SIM PDSA, or the Strategies, Implementation Outcomes and Measures, PDSA. And so on the far left of this tool is a strategy here. And that comes from the DART tool. So it's just sort of carried over onto this worksheet. And on this worksheet, each strategy would have its own row. And so this is just the first row and what that would look like. So for this particular project, one of the strategies is conducting ongoing training with frontline staff on how to use this intervention code HF. And so the next step is to identify implementation outcomes. And in TIARA, we talk a lot about implementation outcomes. So for this particular strategy, we selected adoption and acceptability. There. And then thinking about measure definition. So for example, for adoption, what is that measure going to be, and how are you going to measure it? Same thing for acceptability. And then the plan is really planning the strategy for the implementation, including who, what, where, when, and how, and describing a data collection plan. So that's here. And then the do is executing the plan, documenting what you did, including modifications made to the plan. And in the TIARA program, we talk a lot about modifications and also different ways to document modifications, including those that are planned versus unplanned, and those that are fidelity consistent versus not. Study is analyzing results and summarizing findings and comparing findings to predictions. And then lastly, act is determining whether you need to adopt, adapt, or abandon. And we also talk about that, including presenting sort of a flow chart for making some of those decisions.
All right. And then that takes us to module 6, where we get into sustainability and follow-up. And so we're at the last box of the QIPI here. And this is where we really kind of reflect and think, were the implementation outcomes and the high-level goal or that target achieved, and reflect on the learnings, and then see, what did we need as modification? Is this the new standard? How do we sustain this improvement over time? And also, how do we disseminate results? And so talking about the importance of sustainability, this is kind of the classic, Proctor article on thinking through implementation outcomes. But you can see, sustainability is one of them, and sustainability really is carried throughout the life of the project, and is a really important outcome to include and think about. There are a number of different frameworks that can be used for both evaluation and do include sustainability within them. These include the PSAT, or the Program Sustainability Assessment Tool, REAIM, the Pre-Seed Proceed model, as well as the PRISM model. So also what's important to think about is dissemination planning. So, with any project, QI, clinical, or research, however it may be, it's really important that at the end of the day, you're thinking about dissemination carefully and tailoring your messages to different audiences. It's also important to be thinking about the different modes of dissemination, not just our traditional publications and presentations. Does that mean partnering with community professional societies, doing town halls, in the community or in, clinical or community settings, or through social media, LinkedIn, et cetera. And this is just kind of a good table that can lay out, to whom, what is the message we want to be disseminated, why are we delivering the message, how and when, to really carefully think out and make sure you're including everyone that you want to get results of your implementation to. Also within dissemination, especially if you are publishing either QI or implementation science, there are structured tools for health researchers to use while writing their manuscripts, and standardized article components to enhance reader understanding and research replication. Also, the reporting guidelines are useful for guiding the design, as well as for the writing itself. And these include, in terms of quality improvement, using the SQUIRE, or the Standards for Quality Improvement Reporting Excellence, SQUIRE 2.0 guidelines. And for implementation science, more specifically, using the STAR, or the Standards for Reporting Implementation. So in summary, and we're actually doing pretty well on time, we'll have a good amount of time for discussion here in a moment, but so in summary, the organizing framework for the TIARA program is, the QIPI, the Quality Improvement Project Implementation, or QIPI A3 framework. And this is really thought of as a process framework for a QI project or implementation science project. And kind of reviewing the modules, module 1 in TIARA really goes into the understanding in the actual TIARA course a lot deeper, right, of quality improvement, implementation science, and implementation practice. Module 2 really helping to get TIARA scholars to understand how to define the problem, the current situation, as well as the targets and goals. And then module 3, doing an examination of evidence-based practices that could be applied, as well as assessing root causes and determinants to the problem you have. And then module 4, designing implementation strategies and the recommended intervention. Moving into module 5 of carrying out the plan through iterative cycles of change and PDSAs. And then module 6 on sustainability and dissemination. And then I'll also mention in the TIARA course that we offer, we also do a lot of research applications and considerations, and we do a lot of applying the TIARA framework to a number of different healthcare problems and talk through it with the group as well in terms of people applying it to their own problems. So also for you that work in implementation science, you may know that well-cited statistic that it takes us the quoted in quite a few articles now, the 17+ year gap to get evidence taken up into clinical practice. And that we know translating evidence into practice in communities, it's hard. Also that marrying the ivory tower world of implementation science with more pragmatic real world quality improvement is critical to helping us not only move the needle faster, but more effectively. And TIARA provides some tools and frameworks that are necessary to implement change more effectively and systematically to maximize impact. And with that, well, thank you. We're sharing a QR code here where you can learn more about, the TIARA program, as well as the certificate and the CEs that we offer there, as well as our emails here. And we are excited to take questions and have discussion.
Awesome. Thank you both so much. If everyone could use the Zoom reaction to do a little sound applause or come off, turn their camera on, we would appreciate that. Thank you so much. Oh my gosh. I didn't know that. Nice. I didn't know that they had so many options for that clap emoji. Awesome. So just a reminder to folks, feel free to put your questions in the chat and I can loop back to them. I can read them out myself or invite you to come off mute. I also have quite a few questions myself. So unless anyone would like to start off and come off mute and ask their question, then I'll ask my own question. I'll pause for a second to see. And feel free.
I could ask a question if you like.
Yes, please.
Yes, go ahead.
Okay, sorry. So thanks so much for that awesome talk, Danielle and Stacy. So how do you, with your program, how do you measure success, the success of your teaching and the impact that you have had?
Yes, excellent question. Manuscript in preparation. Yes, so that's a really good question. We have a number of ways. I think the primary way that we are trying to do this was through pre-post knowledge assessments and of the TIARA program. And so because this is to be frank, open, and honest, because this is a marriage between quality improvement and implementation science, there aren't really validated tools that get specifically at what we want to measure. So we kind of scoured and went back and forth between using implementation science competencies as well as quality improvement competencies and frameworks. We found the basic QI to be really great and very aligned to what we were, which is a validated tool really for quality improvement knowledge. And it was really aligned. We just had to, we did slightly modify it a little bit with just a few, additional words or phrases that also reflected some of the implementation science. So it's really an adapted basic QI pre and post knowledge assessment. And then we also ask people for a lot of qualitative feedback, to give in their evaluations as well, so that we can use quotes on, satisfaction and experience as well.
And going forward, because it's a pretty new program, a lot of people haven't had the opportunity to put it into practice yet, but we will be reaching out to individuals to see how they've used it, what they've used it for. And then we're working with Maggie Paddock-Kallman, who developed implementation science competencies. We've been talking with her about developing an assessment tool to assess knowledge of QI competence, implementation science competencies that could be validated.
Mm-hmm.
she helped us to also develop some of the content for this TIARA program.
So let us know when you do that.
Yes. Oh
Thank
my
you.
gosh. Yes. That's going to be quite an undertaking.
Yeah. But we are in the middle of analyses, at least on all the data we have collected so far on our cohorts, as well as on our customized workshop. So we're hoping to get that one. I mean, I don't know, amongst all the other grant writing and other things, as you all know well, when that will get done, but I'll be optimistic and say this fall it gets submitted.
Yeah.
Winter.
Thank
Awesome.
you.
I'm super looking forward to hearing about that kind of follow-up. I was going to ask a question about like what follow-up are you able to do with participants? So it sounds like that's kind of to be continued since it's a new program, and I'm super excited to hear about these things that you're thinking
Yeah.
about.
But I mean, I think no, and that's fair. And I mean, obviously we reached out to everyone who's a TIARA scholar, but I think another thing is we already are seeing what I think is I found most interesting is as a product of TIARA, we've met obviously a lot of really great people, and we've been invited, I would say, just in a very equal mix of people who are working on real world clinical implementation. They want to be change agents and they want to do something in clinical practice, and they've reached out to work with us on how to best do that after being empowered and learning a lot more in TIARA. And then we've also been reaching out and heard from a lot of implementation scientists or people who want to write an R1 or some kind of grant and include this kind of framework for how they want to measure change over time. So already I'm just like speaking, I'm not even remembering the word, but we've definitely observed people applying it in both research and clinical settings, which is really exactly what we wanted and very validating.
Awesome. And Katie had her hand up and has now put her question in the chat. What do people say is the most surprising thing or new thing that they learned in TIARA? Sounds like you might not know yet. So
It depends on so we have a variety of people who take the program. We have people from more of like a QI background who might be, we've actually in our cohorts had a number of social workers, for example, who work at community-based agencies who've been tasked with putting it's like the agency's gotten a grant to implement a thing, but no one there has any training on how to implement things. So for them, a lot of this content is quite new. For others who have more experience with it, I think I don't know if I want to say surprising, but helpful is seeing a lot of the things that they already knew sort of packaged together in a systematic way.
Mm-hmm. Yeah, and we definitely experienced that, for example, through the PCORI HSI. I know you all are involved in, but maybe not everyone on the call is aware, but, the PCORI Health System Implementation Initiative, where, there's 42 health systems around the U.S. all participating in this large way that, PCORI is investing in health systems to implement evidence into practice. And I think, for me, it was part of what spurred and brought on us wanting, the timing of development of this as well. And I think to work with so many, traditional QI trained, nurses on the front line who then are working also in QI and know obviously QI tools and methods and frameworks, but to hear and learn the way we've organized it, I think they've really liked it and have learned a lot. And I hope it'll help us be more, effective in some of, the larger scale implementation projects. So I think that one, trying to think what other exciting or surprising things there are.
I've been surprised just at the variety of people that have taken it. I had originally thought it was going to be primarily clinicians or like nurses and physicians from acute care practice, but it's actually been a lot of, as I mentioned before, social workers or people from non-acute care backgrounds. We've had a lot of people from community-based organizations or health departments. I mean, even when we were in Australia, there were a number of people who worked, more in public health who were there. And I think that goes to show some of the lack of QI implementation science training that that some professions might not necessarily get, or some types of settings that don't have that sort of infrastructure to support a rigorous QI program the way like an acute care hospital has.
Yeah, thank you for sharing. And as a former TIARA scholar myself, I can attest that you do package it really nicely, and it felt very comprehensive, but also like the things that you put together really made sense in my brain. So totally agree with the feedback you've gotten there. And Craig, you've been so patient. I see your hand has been up. Let's go to you next.
Thank you. So starting off, Danielle, Stacy, terrific presentation, terrific program. It reminds me, Paul Batalden once famously has observed that in order to make better systems and better outcomes, we have to inextricably link that to better professional development, which is precisely what TIARA appears to be doing very well. So congratulations. I have a couple of interrelated questions. One is that you said that what you're trying to do, in essence, is create a learning organization. And your program is developed at, I assume, are kind of volunteers, and you describe some of their backgrounds. But I'm wondering, where is that the appropriate time in which to introduce these skill sets to our professions? It's almost, I can tell you personally, it's too late for me. But I think that if you're trying to create, system change towards everyone becoming a learning institution or organization, it seems to me that perhaps introducing teaching the skills should be done at an earlier point in our careers. So I'm curious if you would agree with that, and when would you do that, and how would you do that? The second question related to that is, as you've moved out the TIARA program to other academic centers or hospitals, which I understand have been your primary, participants so far, what do you anticipate you'll need to modify, or maybe you've already done that? How do you modify the program as it moves into different contexts? So, for example, if TIARA moves out of hospitals and academic centers into, the wild world of clinics or healthcare or smaller healthcare organizations or direct service providers, how do you think TIARA has or needs to be changed? Thank you.
Great questions. Do you want me to go first and you fill in, or do you want to? I have answers to both, but I'm sure you do.
I do too. Probably more answers to the first question.
Okay, go ahead on the first and I'll chime in.
So it's interesting you bring up the education question. I'm involved in an organization that Paul Batalden started, the Health Professions Educator Summer Symposium. And we've tackled this thinking through this quite a bit. And at least in nursing and medicine, there are a little bit less so in like health administration. There are accreditation competencies around a lot of these QI principles. And so they're getting some of the content there. And then in practice, at least for residents, they're getting some QI through some of the graduate medical education requirements. I have concerns about the skill set of the mentors for some of these programs. When you launch competencies at such a wide scale like that, you have a lot of people who are faculty who might not have had formal QI training now in charge of training people to meet these competencies, which is challenging. And then you also have learners who may have learned these in their professional education, who then enter healthcare systems where, this idea of improving the work is our work is not necessarily part of the culture. And so a lot of the improvement is done by specific departments, but not necessarily those at the front line who are doing the work. So I think it's important to have this education sort of at all levels, both at the professional education level, then at postgraduate training, and then continuing on into the workplace as professional education.
Yeah, and I mean, I would agree, and I would add just a few more, I guess, applications of that or considerations where one is, there's a program, for example, at our university that is a program we're not affiliated with, but necessarily other than loosely, but where they take faculty scholars and medical students or residents to work with them on different QI initiatives, because it's part of what they must do, right? But they do and learn and apply a certain framework, and so it's a way, now they're working with us to say, how could we use this, for example, as the framework to both kind of re-engage the faculty and get them on the same page of this, but also the medical students and residents, so that they can learn it as something they know. So because they have, if they're in charge of QI or leading something, they really need to know these, even though, as Danielle alluded to, it related to competencies. That's obviously a deeper thing to tackle. I would also say that even just within our purview, we have clinical fellows and research fellows in our institutions, and them as well as medical students. We're trying to find better ways to reach them more and get them integrated. It's not a heavy requirement, but we're trying in terms of time and commitment. So we're really trying to integrate it so we can at least get the most we can. But across everyone who's taken the program so far, it is also a very wide mix across professional levels, which is a great point that you're making, Craig, as well, is that it's important across all of those levels as well to learn these, because often people weren't. I feel like there was another application I was going to say, but I'm not remembering. Volunteers. When and how. But yeah, that was kind of the first one. And then I think the second question about what was it?
Modifications for different
Contexts and
settings.
settings. Yeah. So I think that one, I would say we learned that one trial by fire, because we offered TIARA, and the people who enrolled in the course were of such a broad mix. We had people, in the community, at the health department, even though our teaching applications, trainings, frameworks is definitely very, we're both health services researchers, by background training. So we're thinking about how do we change healthcare and generally within, acute, although we've definitely done work in, outpatient as well. And in fact, through our PCORI HSI, we'll be applying this through, over 100 sites and primary care and others, urgent cares and things like that. So, but I think what's interesting is that the framework itself, I think we just found that it can be pretty easily adapted and used in different settings without a lot of trouble. There were at least a dozen, I would say, people who were applying this project to, community-based programs, we're currently writing actually a book chapter for an occupational therapy, textbook. So I think, while we definitely are more emphasizing acute and some outpatient settings when we're thinking about TIARA and how we teach it and how most people are going to hear it, I do think it's fairly adapted to other contexts.
There were some smaller challenges, like, for example, a lot of people at these community-based organizations don't have access to the sort of medical library services that one would have in an acute care facility. And so for them, getting access to articles about evidence-based practices was a challenge. They also often don't have the analytics support to be able to pull data, and also might not even have sort of the electronic record capability to collect a lot of the data that they need. And so for them, it ends up being a lot more labor intensive. So I'd say the program itself tends to work really well. It's some of those details that are more challenging in those settings.
Thank you. If you don't mind, I'll reach out to you for some follow-up on those points.
Of course,
and if we could also, if you can make your slides available,
yes.
had a rich amount of information, but we saw them for seconds only. So
Sure, yeah, we were
thanks.
really hauling.
Yeah,
All
we
right,
will
thanks.
share. Thank you so much. Yeah, I know we're almost to the top of the hour, but I'll let you, Cassie's trying to lead us. I'll be quiet.
No worries. Thank you so much, Craig, for your great questions. And also, yes, the slides will be available on the SMCI website in a bit, along with the recording of the lecture. So Dr. Olds, Dr. Farr, thank you so much for your amazing presentation and for this conversation. It was so
Having
great.
us. This is
We're
fun.
so happy to be here.
And thank you for including your contact information. So, Craig said he's going to follow up. Anyone else, there's the contact information. I know we're 2 minutes before the end of the hour, and we like to wrap up to give people some transition time, but I hope it will be, this conversation will continue later on. And yeah, this has been awesome. So thank you, everyone. Again, I saw some clapping going on in the reactions and in the chat. So this is amazing, and I want to thank everyone for attending. And then again, Stacey and Danielle, thank you for presenting today.
Thank
Oh,
you.
yes,
Thank you. Take care, everybody.